Acquired immune deficiency syndrome, or AIDS, is a serious condition that weakens the body's ability to fight off infections. It is caused by the human immunodeficiency virus, or HIV, which attacks the immune system. Thrombocytopenia, on the other hand, is a blood disorder characterized by a low platelet count. Platelets are essential for blood clotting, and a deficiency can lead to excessive bleeding. While seemingly different, these two conditions are often intertwined. A significant number of individuals living with HIV/AIDS also experience thrombocytopenia. This connection highlights the profound impact HIV can have on various bodily systems, extending beyond the immune system to affect blood health. Understanding the link between AIDS and thrombocytopenia is crucial for effective management and treatment of both conditions. Recognizing the shared risk factors and potential complications can empower individuals to take proactive steps towards protecting their health. HIV primarily targets a type of white blood cell called CD4+ T cells, which are vital players in the immune response. As HIV multiplies, it destroys these crucial cells, weakening the body's defenses and paving the way for opportunistic infections and illnesses. But the damage doesn't stop there. HIV also disrupts the bone marrow, the spongy tissue inside bones responsible for producing blood cells, including platelets. This disruption can significantly impair platelet production, leading to thrombocytopenia. Furthermore, the chronic inflammation triggered by HIV infection can further exacerbate platelet destruction. This occurs because the immune system, in its attempt to fight the virus, can mistakenly attack and destroy platelets, further contributing to their depletion. This intricate interplay between HIV, the immune system, and bone marrow underscores the complex nature of HIV infection and its potential to trigger a cascade of health complications, including thrombocytopenia. Diagnosing both AIDS and thrombocytopenia involves a combination of blood tests and assessments of clinical symptoms. For HIV/AIDS, the primary test is an antibody test, which detects the presence of antibodies produced by the body in response to the virus. A rapid HIV test can provide results in as little as 20 minutes, offering a quick and convenient screening option. If an antibody test comes back positive, a follow-up test such as a viral load test or a Western blot test is conducted to confirm the diagnosis. To diagnose thrombocytopenia, a complete blood count or CBC is performed. This test measures the number of red blood cells, white blood cells, and platelets in the blood. A platelet count below 150,000 platelets per microliter of blood is generally considered to be thrombocytopenia. Early diagnosis of both conditions is crucial for initiating timely treatment and improving outcomes. Regular testing and monitoring are essential for individuals at risk for HIV infection or those experiencing symptoms of thrombocytopenia. Early detection of thrombocytopenia in individuals living with HIV/AIDS is crucial for timely intervention and management. While some individuals may experience no symptoms, others may exhibit telltale signs that warrant medical attention. One of the most common symptoms of thrombocytopenia is easy bruising. This can manifest as unexplained bruises on the skin or the appearance of tiny red or purple spots called petechiae, which are caused by bleeding under the skin. Prolonged bleeding from cuts or nosebleeds is another red flag. Individuals with thrombocytopenia may notice that even minor cuts take longer than usual to stop bleeding. Heavy menstrual bleeding in women can also be a sign of low platelet count. In more severe cases, thrombocytopenia can lead to internal bleeding, which can be life-threatening. It is essential to seek immediate medical attention if you experience any signs of unusual bleeding or bruising, especially if you're living with HIV/AIDS. Treating AIDS and thrombocytopenia requires a multifaceted approach that addresses both the underlying HIV infection and the low platelet count. Antiretroviral therapy, or RT, is the cornerstone of HIV treatment, and it plays a crucial role in managing thrombocytopenia as well. ART works by suppressing HIV replication, preventing further damage to the immune system, and allowing the body to rebuild its CD4+ T cell count. As the immune system recovers, platelet production often improves, leading to an increase in platelet levels. In cases where ART alone is insufficient to manage thrombocytopenia, additional treatments may be necessary. Corticosteroids, such as prednisone, can help to increase platelet count by suppressing the immune system's destruction of platelets. Platelet transfusions may be necessary in severe cases of thrombocytopenia to rapidly increase platelet count and prevent life-threatening bleeding. These transfusions provide a temporary boost in platelet levels and can be life-saving in emergency situations. Section 6. Shielding your health. Preventing HIV and managing thrombocytopenia. Preventing HIV infection is paramount in reducing the risk of developing AIDS-related thrombocytopenia. Adopting safe sex practices such as consistent condom use is crucial in preventing the transmission of HIV. For individuals at high risk of HIV exposure, such as those with multiple sexual partners or those who inject drugs, pre-exposure prophylaxis, or PrEP, offers effective protection. PrEP involves taking a daily medication that significantly reduces the risk of contracting HIV. Managing existing medical conditions that can contribute to thrombocytopenia is equally important. This includes controlling blood sugar levels in individuals with diabetes and avoiding medications known to lower platelet count, such as certain antibiotics and painkillers. Regular medical checkups, including complete blood counts, are essential for monitoring platelet levels and detecting any potential issues early on. Early detection and treatment of thrombocytopenia can significantly reduce the risk of complications. Section 7. Living with AIDS and Thrombocytopenia, a focus on quality of life. Living with both AIDS and thrombocytopenia can present unique challenges, but it's important to remember that a fulfilling and meaningful life is still within reach. By working closely with healthcare providers and adhering to prescribed treatment plans, individuals can effectively manage their conditions and maintain a good quality of life. Open communication with doctors and nurses is crucial in addressing any concerns and receiving personalized guidance. Support groups and online communities can provide a safe space to connect with others facing similar challenges, share experiences, and offer emotional support. Maintaining a healthy lifestyle is also essential. Eating a balanced diet rich in fruits, vegetables, and whole grains can support overall well-being. Regular exercise tailored to individual abilities can help boost energy levels and improve mood. It's essential to prioritize mental health alongside physical health. Stress management techniques such as yoga, meditation, or deep breathing exercises can be beneficial in coping with the emotional toll of living with chronic conditions. Section 8. The importance of support, resources for patients and families. Navigating the complexities of AIDS and thrombocytopenia can feel overwhelming, but there's a wealth of resources available to provide guidance, support, and a sense of community for both patients and their loved ones. The first point of contact should always be your healthcare provider, who can connect you with local support groups, therapists, and other resources tailored to your specific needs. Organizations like the HIV/AIDS Alliance and the National Hemophilia Foundation offer a wealth of information on managing these conditions, including treatment options, coping strategies, and financial assistance programs. They also provide peer support networks where individuals can connect with others facing similar challenges. For families and friends of individuals living with AIDS and thrombocytopenia, understanding these conditions and their impact is crucial in providing effective support. Educating yourselves about the illnesses, treatment plans, and potential side effects can help you better understand and empathize with your loved ones' experiences. Remember that emotional support is just as important as practical assistance. Offering a listening ear, providing words of encouragement, and simply being present can make a world of difference in the lives of those facing these health challenges. Section 9. A future of hope: advancements in HIV, AIDS, and thrombocytopenia research. The landscape of HIV, AIDS, and thrombocytopenia treatment and management is constantly evolving, with ongoing research paving the way for new therapies and potential cures. Scientists are tirelessly working to develop more effective antiretroviral drugs with fewer side effects, aiming to improve long-term health outcomes for individuals living with HIV. Gene editing technologies such as CRISPR-Cas9 hold immense promise in potentially providing a cure for HIV. This revolutionary technology allows scientists to precisely target and modify specific genes, raising hopes of eradicating the virus from infected cells. In the field of thrombocytopenia, researchers are exploring novel therapies that stimulate platelet production and improve platelet function. These include thrombopoietin receptor agonists, which mimic the action of a naturally occurring hormone that stimulates platelet production in the bone marrow. While challenges remain, the ongoing advancements in medical research offer a beacon of hope for the future. With continued dedication and collaboration, scientists and healthcare professionals are striving towards a future where AIDS and thrombocytopenia are no longer life-limiting